The UK's largest nurses union has warned the NHS is buckling under pressure as new data reveals hospital admissions increased sevenfold in the past month. There are fears of a twindemic, a combination of COVID and the flu, could come to fruition.
It's a combination stretching an already struggling health service. A return of the winter flu, alongside the impact of a newer virus we all have to live with.
What's different this year is it's the first winter that we've had to deal with COVID and flu simultaneously. And what's more, we're seeing an earlier flu season, and we're seeing other infectious diseases, such as Group A strep, occurring out of their typical seasonal pattern. So that means that all those respiratory illnesses in particular are piling pressure on the NHS over the festive period, and our services are already very stretched.
The latest NHS data paints that point further. There are over 3,500 patients a day in hospital with flu last week. That's up from 520 just a month ago at the end of November, and a significant increase on this time last year, when there were only 34 patients in hospital with flu. The result is the number of free beds is at its lowest seen for 6 years, with more than 9 out of 10 occupied. Julie knows what that pressure looks like. When her dad David fell ill on Christmas Day, she began to think the worst.
It's very distressing. And then because you know how the state of the NHS at the minute, you're wondering, is an ambulance going to come? What's going to happen? Is my daddy going to die? It was distressing.
Those latest figures add to fears of a twindemic, with flu cases up and COVID causing staff shortages. The winter pressure isn't new, but what's different this time is the looming prospect of industrial action. With ambulance staff set to strike again next month, one union's national secretary says they've been left with no choice.
Our members ultimately do this job because they care about the public. They do it for low wages, it's social hours, it's at times appalling conditions. This isn't the service they signed up for. This isn't what they want to do. And the real message we have to the public is, at the moment, you can't trust the ambulance service. We want that to change. We need that to change. And all we're asking for is the government to start sitting up, listening, and do something about the chronic pay issues which underline so many of these problems.
With a workforce in crisis, hospital beds filling up, and viruses on the rise, both sides are agreed on one thing. With a new year comes even more challenges. Shingi Marike, Sky News.